When should you not get a breast lift at the same time as your implants? This is a good one. Stay tuned. So, I'm Dr. Albright, plastic surgeon here in San Antonio, focusing on breast and body cosmetic surgery. And we often get this situation in consultation. Patients think they might need implants with a lift. Sometimes that's true, and sometimes maybe it isn't true. So let's talk about times when perhaps you should consider separating implants from lift. So the number one reason we might separate it is patients are likely to achieve the results and the goals that they have with just a lift alone, or with implants alone without a lift, in which case it doesn't make sense to combine them. If you can get by with a lift alone, then you don't have to worry about the long-term consequences of having an implant. If you get by with an implant alone, then you don't necessarily need to accept the scars and the higher risk of combining it with a lift. And so that's probably the most common situation, is that we can get by with one or the other. Two, the second most common reason we may not combine the breast lift with an implant surgery at the same time is actually blood flow or perceived blood flow to the tissues of the breast. And this comes up with some frequency too. I do try and assess for blood flow to the skin. And if patients have had previous breast lifts and we're contemplating doing another breast lift, then they also have scar tissue on the inside that I can't see. And so those are all cases where it needs to be addressed on a case-by-case basis, and I might recommend separating them so as to avoid more catastrophic complications by combining them. And finally, there are two specific cosmetic issues. So one is a patient who's unsure what final volume they want in their breasts. Perhaps they still have a large-ish size breast that's a little bit droopy, and they're wanting the lift, but also the shape from an implant. But they know that by keeping some of the breast volume and then adding an implant, that it might be too big for their frame. And that can definitely happen. And so in that circumstance, it might be better to do the lift, so then you have a better sense of how much additional volume you want on your chest once the breast is positioned where you'd like to see it on the chest wall. And the other cosmetic issue that can come up is if a patient has droopy breasts, but they don't have quite so much extra skin that you can do a formal lift and also fill up that breast skin with an implant. And that is particularly true if the patient has a very wide areola or the pigmented skin around the nipple. If that areola is taking over a large surface area of the breast skin, then it might not be able to get out all of that pigmented skin at the same time as you're trying to fill it with an implant. And so in some select cases, it's better to do a breast lift and just come back later, do an implant and stretch the breast skin out as you would with a primary breast augmentation. That's kind of a short list of why you might consider separating your lift from your implant surgery. And if you're not sure still, why don't you get a consultation with me and we'll discuss it with a physical exam. Hope this helps. If you have any questions, let us know. Take care.